Hello everyone! Welcome back to our channel. Today's episode is a little different. Lily is not going to the park. She is not going to a cafe or a flower market. Today, Lily is not feeling well, and she needs to find a doctor. You will watch her stop a complete stranger on the street and ask for directions to the nearest clinic and say something that makes him look at her very carefully before he answers. You will be there when she tries to fill in a hospital form. She does not know the difference between two words that look almost identical. You will sit with her in the waiting room, and you will be in the room when the doctor tells her, quietly, clearly, what is wrong. Along the way, you will learn how to describe physical symptoms correctly in English, the difference between I have a pain and I am in pain, why positive in a medical result does not mean what you think it means, what prescribed means, and why it is not the same as suggested, and how to stay calm and clear when the conversation is one of the most important ones you will have. Let's dive in.
Hey, good morning. You all right?
I don't think so, actually. I am looking for the hospital, the nearest one with a walk-in clinic.
St. Cath's on Meridian Road.
I see it. Is it very far from here?
About 12 minutes walking. But you don't look like a 12-minute walk morning. Take the 47 bus. Stops right here, drops you 2 minutes from the entrance.
Thank you. Which direction does the bus come from?
From that direction. Comes every 8 minutes or so. How long have you been feeling like this?
Since 2 days.
For 2 days. You'd say, for 2 days. Since is for a specific moment. Since Tuesday, since this morning. For is for a length of time. For 2 days, for a week.
I have been feeling like this for 2 days.
Then you definitely need that bus. 47, right here. Should be along in 4 minutes.
Thank you. I am sorry to stop you.
Don't be. Hope you feel better soon.
Good morning. Do you have an appointment or are you walking in?
Walking in? I don't have an appointment.
That's fine. Can I take your name and date of birth, please? I'll need you to fill this out. Your contact details, medical history, current symptoms. There's a pen attached.
Fill this out?
Complete it, yes. All sections if you can. Thank you. Can I just... Under symptoms, you've written, I am feeling a heavy chest and I have difficulty to breathe sometimes.
Yes.
Just a small thing. We'd say difficulty breathing, not difficulty to breathe. After difficulty, in English, we use the ing form, not the infinitive.
Difficulty breathing.
And a heavy chest, most patients say chest heaviness or tightness in my chest. Makes it easier for the doctor to read quickly.
May I correct the form?
Of course. Perfect. Take a seat. A triage nurse will call you shortly.
Are you Lily?
Yes.
I'm just going to take some initial observations. Blood pressure, temperature, oxygen levels. then ask you a few questions. That okay?
Of course.
How are you feeling right now on a scale of 1 to 10? 10 being the worst you've ever felt.
6. Not the worst, but not good.
And when did the symptoms start?
I am having this cough from 2 days, and my chest is feeling tight since yesterday night.
So the cough started 2 days ago, and the chest tightness began last night.
Yes, exactly.
The way to say that in English is, I have had this cough for 2 days, present perfect, because it started in the past and is still happening now. And the tightness started last night, simple past, because that's when it began.
I have had this cough for 2 days. The tightness started last night.
Perfect. That tells me exactly what I need to know.
Is something wrong?
Your blood pressure is a little elevated, not alarming, but worth mentioning to the doctor. It can happen when you're unwell or when you're anxious.
I am a little nervous about hospitals.
That's completely normal. Nervous is you're worried about something specific that might happen. Anxious is a bit broader, a general unease, even when you can't name exactly what's worrying you. You seem more nervous than anxious to me.
Yes, I think that's right.
Slight temperature. The doctor will be with you in about 15 minutes. You can wait in room 4 just down the hall.
Thank you.
You're doing fine. This is the right thing to do, coming in.
I've been experiencing a lot of fatigue and some dizziness.
Okay, noted. Have you had any recent changes to your diet or medication?
Hello, doctor. My name is Lilly.
So, Lilly, 2 days of coughing, chest tightness starting last night, slight temperature. Let me listen to your chest. Is that all right?
Yes.
Can you describe where you feel the tightness? As precisely as you can.
It is here, in the middle, and a little to this side. It is not a sharp pain, more like something heavy sitting on my chest.
Good description. Is it worse when you breathe deeply?
Yes, and I am having pain also when I cough.
In English, we say, I have pain or I feel pain. I am having pain sounds like pain is something that happens to you, like an event. Pain is a state, so we use have or feel.
It is painful when I cough.
Exactly. And your energy levels? Are you feeling unusually tired?
Very. I slept for 10 hours last night and I still felt exhausted this morning.
Lilly, I can hear something in your chest that I want to investigate. There's a sound when you breathe that suggests there may be fluid or some inflammation in the lower lung.
Is that serious?
I don't want to guess, which is why I'm going to send you for a chest x-ray and a blood test. Those two things together will tell us what we're dealing with. It could be several things, most of them straightforward to treat, but I want to be certain.
I understand.
Do you have any allergies to medication?
Not that I know of.
X-ray is on the 2nd floor. Blood test is the phlebotomy unit, ground floor. That way. Do the blood test first, then the X-ray, and come back to me when both are done. The results should be with me within the hour.
Take a deep breath in for me now.
And exhale slowly.
Based on these
Good.
results, your endocrine levels look good. We just need to monitor the vitamin D.
Are you Lilly? Yes. Come on through. I'll need you to stand against the plate. I'll show you exactly where. Have you had a chest x-ray before?
No, never.
It's very straightforward. No pain, no needles. I'll position you, ask you to take a deep breath, and then hold it. While you hold your breath, I take the image. Takes about 3 seconds. Then you breathe normally again.
3 seconds is manageable.
It is. Stand right here, please. Feet shoulder width apart. Arms like this. Perfect. Now, when I say take a deep breath, I need you to breathe in fully and then stop. Don't breathe out. Just hold it.
I understand. I stop my breath.
We say hold your breath. Stop your breath sounds like stopping breathing permanently. Hold means pause temporarily.
I will hold my breath.
Good. Ready?
Ready.
Take a deep breath and hold. And breathe normally. That's it. All done.
That was genuinely very easy.
Most people expect much worse. The images go straight to your doctor. You can head back down to him now.
Thank you.
Change back in the booth. Leave the gown on the chair.
Okay, doctor, what have you got?
I have your results. Blood test and x-ray both.
Is it clear?
Not entirely. This is your right lung. Here, this slightly hazy area at the base. That's what I could hear when I listened earlier. It indicates fluid or consolidation, tissue that's reacting to an infection.
That is inside me right now?
It is, but it's early stage and treatable. Your blood test results show a raised white cell count, which means your immune system is actively fighting something. And your CRP, that's an inflammation marker, is also elevated. The test came back positive for a bacterial infection.
Positive? That means something was found?
In medical terms, yes. Positive means the test found what it was looking for. In everyday life, positive means good. In medicine, it means present, detected. So positive is not good news here. It's a chest infection, bacterial, specifically in the lower right lobe of your lung.
A chest infection.
Yes, it's common, it's treatable, and you came in at exactly the right time. Had you waited another few days, it could have developed into something more serious, pneumonia potentially. I'm going to prescribe you a course of antibiotics, amoxicillin, standard first-line treatment for this type of infection. You'll take 1 tablet 3 times a day with food for 7 days.
I understand. Prescribed. You said you are prescribing me? What is the difference between prescribed and recommended?
A recommendation is a suggestion. You can choose to follow it or not. A prescription is a medical instruction. It's official. It goes through a pharmacist, and there are specific legal rules around it. When I prescribe something, I am taking medical responsibility for that treatment.
So it is more serious than a recommendation?
It carries more weight, yes.
I will take all 7 days, I promise. Thank you for explaining everything. Not just what is wrong, but how to say it correctly also.
Take care of yourself.
Goodbye, doctor.
She had arrived not knowing what was wrong. She had left knowing 3 things. Positive in medicine does not mean what she thought. She had also learned that frightened takes of, that difficulty takes an ing, that holding your breath is different from stopping it, and that a prescription carries more weight than a recommendation. Lily is learning day by day with new events. Subscribe and be a part of Lily's journey of learning English in New City.